Have you ever heard the phrase that your interview begins before your interview? Usually that's just a figure of speech. But recently I spoke to a successful consultant candidate whose interview genuinely began before the interview panel had asked him a single question. Before anyone asked, "Tell me about yourself," he had already chaired a stakeholder meeting, written a response to a patient complaint, and prepared a 5-minute presentation. In other words, he was already being assessed as a consultant. Now, today, I want to look at those exercises because I think they tell us something important about where the consultant interviews are heading. We'll head into the presentation and the details of the questions the next time round. So we'll focus on the first two exercises. So I'm going to call this candidate Ben. It's not his real name, but he was happy for me to discuss his interview and lessons from it, but he didn't want to appear on camera. So we won't use his real name. We'll call him Ben. Now, a few years ago, you would turn up for the interview, sit in front of a panel, answer questions, and then you'd go home. Today, it's just increasingly common that the trust wants some evidence that you can already function at a consultant level and not simply think like one. That means demonstrating leadership, communication, judgment, professionalism, all of those things that are meant to be qualities of a consultant before the formal interview even starts. So Ben receives this email about 30 minutes before the meeting on the topic of resident doctors increasingly working less than full time. Now, in doing that, he had to look at how we can continue to provide a safe service. And whilst he was at it, he was asked to demonstrate the trust values. Now, this is an excellent exercise because it's another one of those things that nobody teaches us as residents or trainees: how to chair meetings. Attend meetings sometimes, but we rarely ever lead those meetings or chair those meetings. Yet, when you become a consultant, you will spend several years chairing those meetings. So what's the panel actually assessing? Well, I think they're assessing whether you behave like a consultant and whether you can structure a discussion, include everyone, keep people on topic, summarize things, move towards decisions. And to that end, my suggestion is that your starting point should be not to ask what everybody thinks, because that could basically lead you down a path where you don't want to go into. So it leads to an unstructured conversation. Instead, I'd define the problem first. So you could say something like, "We're here to discuss how increasing less than full-time work affects service delivery, and that you'd like the team members to consider 5 or 6 different areas. Those areas could be things like patient safety, workforce, training, finances, sustainability, or literally anything sensible that you can come up with in the time that you get in the prep time that you get before you start the meeting." And then use the stakeholders properly. So the stakeholders for this meeting were 2 resident doctors, an ICU matron, and this was an ICU consultant interview, so it made sense to have an ICU matron there, the departmental secretary, another ICU consultant, and so basically 2 ICU consultants there. And every one of the members of that meeting, they're seeing the problem from a different point of view. The secretary probably knows exactly how many rota gaps exist. The residents know why people are doing less than full time. Well, it's a national trend now. And the matron probably has dealt with similar nursing workforce problems. ICU consultants understand downstream impact on critical care. So your job isn't to tell them the answers, it's basically to bring those answers together, bring their points of view together. Now, the big ask here was to demonstrate trust values. How do you demonstrate trust values in the middle of all of this? So the first thing to understand is that trust values nationally are somewhere in the realms of 4 or 5 things, which are things like respect and compassion for patients and colleagues, teamwork, high quality patient care, service delivery, integrity and honesty, and inclusivity and respect for colleagues and patients. Now, as you're going through the conversations, you're constantly demonstrating these values by hearing the stakeholders out, respecting their opinion, targeting your discussions to the safety of patients and the well-being of our residents, and ensuring that less than full-time trainees are not disadvantaged in any way and that there is no detrimental effect to patient care. So as long as you don't bulldoze your way through the meeting and don't force your opinion on other people and don't have any extreme views on any of these things, or at least don't talk about them during the meeting, you'll probably be fine. And then there's a tendency to run out of time if you don't keep a grasp on it. And as you're coming to the end of this meeting, well, obviously keep a timer, and you'll have a timer on your Teams invite or whatever app you're asked to use. Keep an eye on the time. And as you're coming to the end, summarize, identify areas of agreement, highlight unresolved issues, and agree next actions. Because I don't know if you guys know this, but NHS managers love an actions list from the last meeting, and allocate responsibility. So, this is where delegation comes in. And that feels like somebody who actually runs meetings rather than someone who's completely like rabbit in headlights. So I know it's easier said than done, but you can help yourselves a lot by preparing for random things like this, by attending meetings regularly, particularly in the year just leading up to your CCT. Ask to attend a few meetings across different areas. So things like a clinical governance meeting or a performance review meeting, which will be happening somewhere in your departments, or even attend some part of a consultant meeting. I mean, you could attend for the first few minutes and then leave if and when they move on to sensitive matters. So that was exercise number one, but this is still before Ben has reached the interview panel. The next thing he was asked to do was to respond to a patient complaint. The scenario he was given was that of a young female patient who had had a perioperative cardiac arrest or a bradycardic episode during surgery, gynae surgery. She was admitted to ICU after this episode. She was very unhappy that, first of all, the operation hadn't been completed, obviously, and secondly, the fact that despite her anesthetist promising her that he'll come and talk to her and explain what happened during the procedure, this hadn't taken place. So the patient was unhappy about what had gone on and was very, very concerned about how this was going to be dealt with in the future. What happens when she comes back for her actual operation? What measures will be put in place to ensure that it doesn't happen again? So that's the sort of thing which came up in the complaint. Now, think about what they're really assessing here. They're not assessing whether you know how to apologize. They're assessing whether you understand accountability. And this is where clinical governance comes in. Do you understand what clinical governance means? I mean, you read about the pillars of clinical governance before you go into it. This exercise really tests out the applicability of these pillars. So personally, when I read these complaints, I think about three or four things. The first is you have to acknowledge the fact that the patient feels let down, and for one reason or the other, whether you agree with it or not, from the patient's point of view, they've had a bad experience. Second, identify every issue, because you will find as you read through a few complaints that complaints are very rarely isolated events. Unhappy patients are unhappy about more than one aspect of care, and it's overall been a bad experience for them. So there will be 6 or 7 different unanswered questions. So, and then you obviously go into what happened, why did it happen, who investigated it, and is it safe for the patient to have the surgery again or not? These are the sort of things that they might ask. So you need to address all of those things. And a complaint then isn't finished because you've written a letter. I think you can demonstrate in your reply to complaint like this that you know, I'm talking about this particular exercise, that you know what happens afterwards. Things like duty of candor, which should have been done at the time. It might have been done superficially by telling the patient what happened, because clearly she knows what happened, but doesn't know any deeper about it. So those are the sort of questions which still need to be answered, and they form part of clinical governance. Another important thing that patients ask is, will the same thing happen to other patients? Now, it's not just a question to answer. I think it's something that you should address in the letter as part of the clinical governance framework to see that this doesn't happen to another patient, and you will build safeguards into the system to ensure that it doesn't happen again. And this is where I suggest that you can learn about what goes on behind the scenes by getting involved with the clinical governance lead in your department and ask to see a letter of complaint which they might have responded to in the past. And believe me, there are complaints. The complaints come in quite often. In the future, I'm going to do separate episodes on many aspects of clinical governance about what you should do, or if you come across a mistake, or you've made a mistake and now need to go down the route of doing an incident form, what actions take place after you've done an incident form. what gets investigated, what are the steps to be taken, and all other aspects of clinical governance. So do watch out for that one. And on the subject of future episodes, if you are liking this episode, wherever you're watching it on YouTube, Spotify, or Apple Podcasts, or listening to it on those platforms, please, please, please do give me a like or a rating or leave me a comment. Anything good, bad, ugly, very nice, whatever you want to say, but it just makes me I know there's a growing number of you listening to these, and if you give me any kind of feedback, that will be great. If you want to, you can reach out to me and drop me a line at atracurium@gmail.com. Yes, that drug, atracurium. Very simple email. I was lucky enough to get it many, many years ago. Just atracurium@gmail.com. So coming back to this episode, all of these things point to the fact that your employing trust is trying to see how you're thinking and whether are you starting to think like a consultant already or not. It's not about answering a complaint or making a presentation or chairing a meeting in itself. Behind the scenes, they want to see if you can take a complex situation, organize it, communicate effectively, and restore trust in your colleagues and your patients. And I think that's what they're trying to assess with it. So coming to the end of it, Ben still hasn't started his interview. The formal questions hadn't begun, yet he's already demonstrated aspects of leadership, communication, professionalism, organization, and judgment. Now, in the next episode, we'll move on to the presentation that he had to make, which was a very, very interesting topic. And the questions that got asked, which was also, I mean, there were some regular routine questions, but also some that got asked were very, very topical. And in fact, Ben got asked about a recent report published by the Royal College of Anaesthetists. So keep an eye out for the next episode where we'll go into all of those questions in detail. See you shortly.